Hi everybody, Dr. Yao here. Today I'd like to share one of the cases in my practice. It's a very unique and special case. It's a surgery case, and what a surgery case is it involves both orthodontics and oral surgery together to create a better smile for the patient. This particular patient has been kind enough to share his case with all of you, so let's go ahead and take a look. Here is the patient when he first presented to me. He was 25 years old, and his chief concern was, I want a better smile. So let's go ahead and take a look at his smile. If we take a look at his top right photo where we're looking at him smiling, you can see that his smile is actually pretty good. It's definitely acceptable, almost cute. So if I had to be super critical, the only thing I would say is his smile is a bit flat, meaning his teeth are on almost a straight line. Normally I like to see a little bit more curvature where the top teeth follow the lower lip a little bit more. This will give a more aesthetic smile. It creates what we call a smile arc. It gives a much nicer, welcoming smile. Looking inside his mouth, let's take a look at the bottom center photo. You can see that when he bites down, his back teeth are touching, but in the front, there are areas where the teeth do not overlap. This is probably where the unaesthetic portion comes in and where the chief concern comes in. In addition, this type of bite is not as functional. For example, if you was to eat a hamburger, the areas where the teeth are not overlapping would have a hard time chewing through that hamburger. When you take that first bite, and if there's lettuce in there, the lettuce would just slide past those front teeth and you wouldn't be able to tear them off. So those are areas for improvement. Looking at the pictures on the bottom left and the bottom right, those are the sides of his teeth. You can see that his teeth are almost in like a same angulation. His top teeth are leaning forward and his bottom teeth are leaning back, so they almost look like there's a slide going on. Normally, the top and bottom front teeth should both be leaning forward, but here the bottom teeth are definitely leaning back, which means that we need to improve the inclinations of those bottom teeth. And finally, let's take a look at the photos in the second row, both on the left and right. The left one shows his upper teeth. There's plenty of room for all his teeth, no significant crowding, everything looks fairly nice. And he also has a nice wide arch. On the right side where it shows the bottom teeth, there's a little bit of crowding in the front, but otherwise nothing too remarkable. So normally when a patient comes in, we like to see their face, and then we also look at their teeth, and we look at their x-rays, and then we determine where the issues are, and then we determine how we are going to go ahead and treat it. So let's kind of break it down a little bit. I just want to show you some of the things that I think about when I see a patient's face and look at their teeth, and then give you guys a rough guideline on what goes in my mind, and then how we came up with our treatment plan for this particular patient. So here we're looking at the patient straight on, just at his face where he's resting, and there's no posturing in any of the facial features. I like to draw an imaginary line. This will show any asymmetries on a patient. For this particular patient, he actually looks pretty good, but if you look really close at his chin, you can see that his chin is a little bit to his left side. So we're looking at the patient's to our right, but for the patient's to his left. So the chin seems to be deviating to his left side. So there's a kind of a right-left discrepancy here. And then here we're looking at the side of the face. This gives us an idea of the front-back relationships of everything. And you can see here, I'm going to also do an imaginary line, and this will allow me to see where his nose is, where his lips are, where his jaws are. For this particular patient, you can see that his top lip is a little bit further back than his bottom lip, and it looks like his bottom jaw is a little bit more forward. So there's definitely also a back-forth issue with this patient. Here we're looking inside his mouth, and to see if there's any asymmetry in the mouth as well, we can look at the center. So we can look at the top center, and then we can look at the bottom center. And you can see that the centers in this particular patient do not meet up. His top center is more towards his right side, and his bottom center is more towards his left. So this confirms that there's definitely an asymmetry on the right and left, both in the jaws and with the teeth. But we have to determine whether the issue is with the teeth themselves or with the jaws. The best way to do this is by taking some x-rays. This x-ray is perfect for showing any front and back discrepancies. This is also known as a cephalometric radiograph, which I covered in another video. Here for this particular patient, you can see that his top teeth and his bottom teeth, they have a little bit of discrepancy, which is then reflected in his profile. Usually with these x-rays, I like to do some measurements on it, trace it, and then I take some angular measurements and some distance measurements, and I look at it compared to some norms for a patient at this age and with this ethnicity. What the measurements have shown is that his top jaw is actually in a decent location, but it's definitely further back than the bottom one, and the bottom one is protruded or it's very forward. In addition, the inclination or angulation of the top incisor or the top front tooth is in a fairly normal location, but the bottom tooth is definitely leaning backwards. It's very upright and it needs to procline or lean forward to have a much more aesthetic look. These are the pictures from the beginning. So at this time, we presented two treatment options to this patient. The first option is to do ideal treatment, which will involve moving both the teeth and the jaws into their correct positions. The second option is a compromised treatment plan, which would be to move the teeth within the confinements of the jaws. The patient elected to do ideal treatment. Then this would involve an oral surgeon as well as an orthodontist. The oral surgeon will be repositioning the jaws, the orthodontist will be repositioning the teeth. The timeline kind of works like this. The patient will have to see both an orthodontist and oral surgeon in the beginning for a consult. After the consult, the orthodontist or I would be making his teeth straight within the jaws separately. The surgeon will then take over and do the surgery to position the jaws, and then finally the orthodontist would make sure that the teeth are in good occlusion and his smile looks great before removing all the orthodontic appliances. Here's an x-ray that is taken before surgery. These are his pre-surgical x-rays. We like to take radiographs before surgery just so that we can make sure the patient is actually ready for the procedure. With this x-ray, I can make sure that the inclinations of the teeth are in the right positions, and so that when the surgeon moves the jaws, the teeth will already be in good occlusion. We can see the difference by looking at the initial x-ray and the one pre-surgery. You can see, especially on the lower teeth, after the braces, they are leaning forward now and they're in a much better inclination. And this is a radiograph after surgery. In the front, you can see that we have a beautiful relationship between the top and bottom teeth. The top teeth are ahead of the bottom teeth. You can look at the jaws. The jaws are much better proportioned and balanced. You can even see the little appliances that were used by the oral surgeon to reposition the jaws both on the upper and on the lower. Here's another image of the appliances. This is a panoramic radiograph, and it's a panorama of all the teeth, and you can see that on the top there's some minor appliances that were placed towards the nose area to reposition the top jaw, and on the bottom there's these two small metal slivers that were used to reposition the lower jaw. And then you can see that all the teeth come together nicely, and if you look closely you can see that the top and bottom teeth in the front are actually overlapping in this image. As the orthodontist, I usually get to see the patient about 4 to 6 weeks after surgery. So this patient came back after about 6 weeks, and look at his front smile. Although he couldn't open quite wide just because he's still a little bit swollen from the surgery, you can see that he has a much better relationship in the front. His smile looks a lot better. He does have these rubber bands going on the side. These are attached to the little hooks that are onto the braces, and they're just meant to make sure that the bite stays pretty stable and that his jaws don't move around while he is healing. And this is the picture that you're probably waiting for. This is when he was finished with everything. So he's done with his braces as well as the surgery. You can see how nice he looks. The teeth are in a much better relationship. The lower teeth are no longer leaning backwards. His front teeth and bottom teeth overlap, and his profile is much more balanced. I'm going to go ahead and show you the individual photos by themselves for a good comparison. Here's the frontal picture that we saw in the very beginning, and we have the imaginary lines that are placed. You can see that the chin is actually a little bit more centered. It's very subtle, but it is evident. And this is the side profile. Again, let's put our imaginary lines in, and now you can see that his top lip and his bottom lips are in a much more balanced position compared to where he was in the very beginning. And of course, those teeth on the inside, you can see how nicely they've centered up and everything is overlapping and there is a much better occlusion. I hope you learned a lot looking at this case with me. Thank you so much to the patient who has kindly allowed me to share this case with everyone. And thanks for watching. Bye-bye.